Statistics from the Department of Health indicate that over 7,400 children were treated for attempting to take their own lives in 8 months. Just a word of warning that this conversation will contain some graphic details related to suicide, death by suicide, so please do be aware of that as we go into this discussion. Now, most of these children were under the age of 18. The numbers come at a time when basic education marks Teen Suicide Prevention Week, which ends on February 16th. Let's bring in Sibongile Monareng, who is the Director of Psychosocial Support at the Department of Education, who joins us now live for this discussion. Sibongile, thanks very much indeed for your time. I mean, these statistics are frightening, but the reality is these aren't just numbers. These are children with families, futures.
Indeed, Michelle, and thank you so much for this opportunity, because we do need to talk about this and we do need to start destigmatizing engaging about mental illnesses. We think it is a tragedy that we need to work together to solve.
So more than 7,400 children under the age of 18 actually attempted suicide in 8 months. That's what these numbers tell us.
Indeed, and these are just the numbers of children that would have ended up at a hospital, Michelle. And we know that a number do end up dying by suicide. And what we are finding from our partners and from managers at district level is that we are seeing a rising in number of learners in primary schools actually dying by suicide as well. So this is really becoming a serious problem for us as the education department, and I think for everybody in the community. But I have to say, Michelle, this is not just a South African problem, it is a global problem.
I just want to clarify, just for some context for our viewers, these numbers are from between April and December of 2024. And it works out to, on average, over 900 children treated for a suicide attempt during that period every single month. How does that compare to perhaps previous periods under review?
So, Michelle, we have started asking the Department of Health to give us these numbers. And the reason for that is as we put systems in place, we want to be able to know that we are making a difference. Indeed, we are seeing increases in numbers of children that are presenting with mental health challenges. Hence, we are worried about this. Hence, we are commemorating this week.
Yeah. You talked about suicide remaining a global health challenge. And part of what the department is doing with this focus on suicide prevention this week until Sunday is highlighting the need for efforts to address mental health challenges among young people. How far do those conversations go? Do they happen perhaps only in a school environment? Do we try and involve parents in that kind of education? So it's not just about educating the young person, but also the family environment.
Yes, Michelle. And, you know, one of the biggest challenges that we experience as a sector is parental engagement. But yes, indeed, when educators do notice that a learner has a challenge, whatever form of health challenge, parents do get involved. But the reason we are actually engaging so widely this week is that we want parents to actually take notice of the importance of taking care of their own mental health, but also of their children's mental health. That's why we are engaging in this campaign. However, even in the schools, working with the schools, we are capacitating them with information so that when they have meetings with their parents, they're able to engage with them. You know, but they need information as well. The biggest problem, and I think you and I have had a conversation before, is that in South Africa in general, there isn't enough information about common mental health, common mental health conditions. And this is what we are trying to do, and we're doing this with our educators in our schools as well.
I mean, the challenges facing young people are so wide-ranging, aren't they? There's the pressure of social media, there's education, there's poverty, there's struggles in the home, unemployment. So it's not, I suppose, just about, as important as mental health is for young people and making sure that there are open lines of communication. It's difficult when so many of those issues are also socioeconomic.
No, true. So the drivers of suicide and mental health issues include bullying. They include socioeconomic issues, lack of family support, violence in the home, divorce by parents, pregnancy as well. One of the things that we are encouraging, Michelle, is for people to seek help for mental health challenges, right? Because yes, maybe we may not be able to change the environment where the young people are coming from, but if we're able to build resilience, if they feel safe to express themselves in the home, if they feel safe to express themselves in the school, then they're not gonna feel hopeless. Because often what drives people to decide to die by suicide or to attempt is feeling hopeless. But there is help available. Mental health challenges can be addressed with the relevant support. The important thing is to actually, for learners to feel safe, to feel that they have someone to talk to, someone who gives them hope. So that's why we are focusing on mental wellness promotion and prevention of mental illnesses. And of course, early identification for those that require support.
What would be your advice to parents and caregivers on what they need to look out for in their young people?
So I think before looking out, Michelle, it starts by creating safe homes. By safe homes, psychologically safe homes, peaceful homes, right? Homes where learners feel supported, where they know that they can trust their parents, where they are protected from violence. That's where it starts. However, there are things that can be looked out for, like if somebody starts isolating themselves from friends, from activities they were undertaking, if perhaps they are no longer taking care of themselves, maybe they start using substances, or there's now risky behavior. In some instances, individuals that are suicidal would actually say that they would rather die. Oftentimes, family members and friends in retrospect will say, actually, he or she did say something. They did say that they didn't want to live anymore, but we often don't take those seriously. So I would say that we need to check in on our children. Are they happy? Talk to them about school. How was school? How is your relationship with your friends? Is everything okay? So parents need to initiate those conversations. How are you doing with your subjects? Because also challenges with academics in school can lead a learner to feel that, you know, there is no use, I would rather die, or they can be bullied for being older than their peers in a classroom. So the critical thing is for parents to actually know their children so that they can identify when they're not doing well, but have those conversations. Also because some children do not tell their parents when they're being bullied, particularly boy children. So I would say, Michelle, it's a matter of creating a protective environment for our children and also open communication. Our parents, we need to start talking to children and knowing them and taking care of their emotions as well, and know that their feelings matter.
No, absolutely. Keeping those lines of communication open. Let me thank you for your time. Sibongile Monareng is the Director of Psychosocial Support at the Department of Education. The department is marking Teen Suicide Prevention Week this week. It started on Sunday and it will be until this coming Sunday.